Hello, my name is Tamika Hines. I am a DNP student at Jacksonville State University in the Department of Nursing. Today I'm presenting to you my DNP project entitled Improving School Attendance Rates Utilizing a School-Based Clinic. In this project, we will discuss the background issues related to attendance and health. We will discuss the project purpose, list our objectives for this project, identify our PICO question, discuss the theoretical framework used in this project, a review of the evidence, the design method for the project, the actual project implementation, outcome analysis, our conclusion, and implications for practice. In the United States, 25% of school-aged children have chronic health conditions. School absenteeism is linked to a range of health concerns, health risk behaviors, and school dropout. Children and adolescents with a chronic illness tend to demonstrate diminished physical and social functioning, which contributes to school attendance issues. In this DNP project and in the project high school, on average, the student enrollment was 661 students. There are an average of 107 students with disabilities, and there were 143 student absences during the months of August through December 2018. The purpose of today's project is to implement, compare, and share. There was the implementation of a school-based health center in the project high school. We will compare student attendance data pre and post the implementation of the school-based health clinic. And the data and the analysis of the data will be shared with district leaders and community partners to decide if it is feasible and sustainable to continue school-based health clinics within the proposed district. Our objectives: after viewing this presentation, individuals will be able to identify the relationship between chronic health conditions and student attendance. The individual will be able to compare pre and post data of the DNP project proposal, as well as assess the need for future inquiry around school-based health clinics. The problem. The PICO question will address and highlight the problem that led to the burning question of: does the implementation of a school-based health clinic decrease the number of student absences for students in a 9th through 12th grade high school? Betty Newman's systems model was the theoretical framework that guided the DNP project. Newman's system model addresses the whole individual in relationship to stress and the environment. And the circle that's listed here will highlight the main points of concentration in this project. One being holism of the child, wellness promotion, orientation, student insight, the system perspective, the environment, as well as internal and external stressors. Continuing on with the theoretical framework, Newman's model addresses the 3 areas of prevention that furthers and promotes optimal health and wellness for our students and staff, thereby decreasing student attendance. And if you look at the primary prevention, secondary prevention, and tertiary prevention, the school-based health clinic touches each area of prevention in different ways and through the services that the clinic will provide. The review of the evidence also supports the implementation of school-based health clinics. School-based health clinics improve access to health care for children, thereby increasing their time spent in the classroom learning. Substantial educational benefits associated with school-based health clinics include the reduction rate of hospital visits, school suspensions, and high schools graduation rates, and increasing grade point averages and promotion. What this means is that there are higher student achievement noted when and at the implementation of school-based health clinics. Finally, academic functioning and school absences are among the factors related to help seeking in adolescence, indicating that health services can be incorporated as an intervention to reduce absenteeism, especially for our high school students. The implementation of the school-based health clinic allowed the project school and the students to have access to a wealth of healthcare services, which included wellness exams, sports physical, lab services, acute and chronic illness care and medical care, x-rays, immunization, referrals for specialized care, flu shots, vision screenings, behavioral health, and women's health. And it is important to note that currently, even during this time when we are away from school, the school-based health clinic is still in operation, and where our students and staff have the ability to utilize the services for COVID-19 testing. And to date, I can say that there have been over 100 COVID-19 tests done at the project school-based health clinic. The design method used for this project is a mixed method project analysis, which assesses the effectiveness and the efficiency of school-based health to student attendance. The attendance data collected was from August through December of 2018, compared with the attendance data from August through December of 2019 school year. A Mann-Whitney test was done to conduct the analysis of the data. The implementation of the project, the DNP project was school-based health clinic was opened in August of 2019. The high school setting impacted students from ages 14 to 21. The study population was 661 students, with 107 students with disabilities. And the Mann-Whitney test again would be the system, the analysis would analyze the data and the numbers. All students of the Project High School are included in this DNP project. The outcome analysis. The frequency of chronically absent in December 2019 exceeded frequency of chronically absent students from any point in time recorded in the 2018 school year. Between August 2018 and December 2019, there was an average of 143 absences per month. But during the same time period in 2019, after the implementation of the school-based health clinic, there was an increase of absences of 154 per month. So we took a further dive and look at the services and the patient visits to the school-based health clinic. And we noted that there were 277 total patients that visited the school-based health clinic. Of the visits, we know that 156 students use these services for behavioral health, which is an average of 56.3%. It is also important to highlight that most of these students would start regular and routine visits to see the social worker and therapist through the clinic. So that was a very positive note for the school-based health clinic. Also, in the clinic, we were able to evaluate 66 students for sports physical, which is 23.8% of the visits, and 55 students for illnesses or injuries, which are 19.9% of the total visits. A very big highlighted note is that of the 277 total patients, 232 of those students visiting the clinic returned to class, which is very positive for the promotion of school attendance in itself. 36 of the 277 students were sent home at a rate of 13.45%. At the conclusion of the project and the implication for practice, it is determined that the data analysis did not support our proposed conclusion. Also, we noted that based on the conclusion, additional projects are needed to evaluate the impact of a school-based health clinic to improve student health and outcome. The data, however, did support the need for additional support around mental health. Therefore, the school-based health clinic could benefit from the employment of a mental health coordinator. The school-based health clinic found additional traction and support in the implementation of future school-based health clinic. And as a matter of fact, during the project year and project time, we did implement an additional school-based health clinic at an elementary school. And I think one of the greatest highlights that we would like to note is that also our state legislatures are paying close attention to school-based interventions. And therefore, in the State Department of Education enacted Act 2020-169, which is the legislator established a position for a school-based mental health service coordinator and appropriated $4.5 million to provide grants to local educational areas, which mean local schools, to employ a mental health coordinator to support and expand coordination of mental health services throughout the school system. And also, after the implementation of this project, the second largest school district in the state of Alabama will now seek to model this project implementation in their school district. So we are very excited that the work for school-based health will continue. If you have any additional questions around school-based healthcare, as well as school-based health in relation to services or implementation, please feel free to contact me at thines@stu.jsu.edu. And finally, we will list our references that was used in formulating the data and information that is implemented and shown within this DNP project. Thank you for tuning in. I hope you enjoyed.